Okay, so the first the first type of contraception we're going to talk about is natural family planning or natural methods. This is a really big umbrella. You've probably heard the joke, what do we call people who use natural birth control methods? Parents. There is some truth to that, but there's a caveat. Most people who use natural family planning or who think they're trying natural family planning don't have enough information and aren't doing it correctly. So the very first thing is if we use no contraception, 85% of sexually active women of reproductive age who are using no contraception will conceive within 1 year. So no contraception at all, 85% are going to conceive in 1 year. So what are the methods that don't involve drugs, devices, or surgeries? First is abstinence. Abstinence is 100% 100% effective with perfect use. Perfect use is very difficult to attain for adults. Okay. There aren't a lot of adults who are celibate by choice for a long time. So abstinence tends to fail kids in particular because kids are the ones we're telling to be abstinent because they end up not being abstinent. Now, there is also the risk if someone is using abstinence as their only contraceptive measure. If they are raped, there's also the chance of pregnancy. But abstinence is 100% effective. The only risk is not having sex. Coitus interruptus, there is a chart. I'm going to show you. Actually, there are a couple of charts. Let's look at these real quick. This one. This is a chart that shows this is the percentage of women who have an unintended pregnancy during 1 year of typical use and 1 year, or the first year of typical use and the first year of perfect use for a lot of different methods. And they're not all on this list, but there are quite a few. We see no method, it's 85, withdrawal. You can see a big difference here between typical use and perfect use for coitus interruptus or withdrawal. With perfect use, only 4 out of 100 women are going to get pregnant in a year. That's really not terrible. There are better methods or more effective methods, but that's not terrible. But typical use, 20% are going to get pregnant. And that's because perfect use requires control. So you can use this chart to compare different types. There's also a handout that sometimes patients are given. Let me see if this is the right one. Yes, and it shows just less effective to more effective methods. And this is based on typical use. This chart is not based on perfect use, but typical use. Okay, so let's talk about, we've talked about abstinence. Coitus interruptus is withdrawal of the penis before ejaculation. The risk, there aren't any risk from this except that ejaculation will be unexpected. Preseminal fluid does not contain sperm. That's a myth. Some people believe that preseminal fluid contains sperm. Now, if that man has ejaculated recently, there may be some living sperm still in the urethra that can be expelled with the preseminal fluid, maybe washed out by the preseminal fluid. Won't be a lot of them, but they could be there. The failure rate with perfect use is 4%, with typical use is 20%. And the major issue with this is unexpected ejaculation. Okay. Fertility awareness methods, also maybe called natural family planning. There's a lot of them. The failure rate with typical use is 15%. It used to be 24% and it's down. So that may be because of better education. There are a lot of different methods and they have varying reliability. All of them require commitment and they require the partner to participate. The calendar rhythm method is the most common and probably the least effective. The length of the menstrual cycles has to be recorded for 6 months without using any kind of hormonal contraception. So for 6 months, they have to use methods that are not hormonal. That means mostly barriers. Okay. In that 6 months, for that 6 months, they record the length of their cycles. And then they subtract 18 days from the length of the shortest and 11 days from the length of the longest. And that range is the fertile period. And during the fertile period, for the best results, they would abstain, but people often will go ahead and have intercourse during that fertile period and use a barrier method. The risk, ovulation can be unexpected. Sometimes the reason that they want you to record 6 months of data is to give a better picture of when ovulation usually occurs for that particular person, but it's still not always going to catch every ovulation. So there's a failure rate there. Women with irregular cycles are more likely to get pregnant using the calendar method. The standard days method is similar to the calendar method, but you don't have to collect that 6 months of data first, and it's got fixed days. On days 8 through 19, the woman is instructed to either avoid intercourse or use a barrier. Obviously, if they use a barrier, there's a potential for breakage, so be aware of that. Some women use cycle beads. There are phone apps or other reminders. The major risk of this, unexpected ovulation. And again, women with irregular cycles are more likely to get pregnant using this. The basal body temperature method. And now we're getting into some methods that look at some actual assessment. A more sensitive basal thermometer is used. We looked at this chart a little bit already with trying to conceive. So that thermometer is used and it detects really slight changes in body temperature. The temperature has to be measured each day immediately on waking before getting out of bed. So open eyes, insert thermometer, okay? A slight drop is common at ovulation and then an increase just after. The temperature stays at a higher level until just before menses. And so to use this for contraception, if you're using only basal body temp, then they would abstain from the first day of the menstrual period until 3 days of a sustained elevated temperature. This method also can identify a pregnancy very early because the temperature drop doesn't occur. Risk and drawbacks, again, an ovulation can be unexpected. You're more likely to catch an ovulation using this method than the methods that with just counting days, but it still can happen. Women with irregular cycles are more likely to conceive, and abstinence or a barrier method is required for about half of each month. So this takes unprotected sex off the table for about half of the month, which is a deal breaker for some couples. The cervical mucus method, cervical mucus characteristics change through the month. It becomes thin, slippery, and stretchy a day or so before ovulation. Remember, I told you about that. That slippery cervical mucus allows the sperm to get through easily and facilitates motility. Conception is really unlikely if there's no slippery cervical mucus. It actually can be a factor in infertility. And one of the things I didn't mention with treating infertility was using guaifenesin, because it's not, it's one of those off-label, people pass it around on the internet kind of things, but guaifenesin thins mucus. And sometimes when people are having difficulty conceiving, they'll take guaifenesin in the hope that it will thin that cervical mucus as well. So if you don't have the thin, slippery cervical mucus, conception is not likely. Cervical mucus is checked with the fingers daily, and that involves putting the fingers inside and touching the cervix, not just the vaginal wall. The person would be taught to abstain from the beginning of wet mucus until 4 days after the last wet mucus day. And that can also be marked on that chart like we saw. The risk and drawbacks, unexpected ovulation, although this is a really good predictor of ovulation. Women with irregular cycles are more likely to conceive. There are some factors that can change the consistency of cervical mucus or that can make it hard to tell. So vaginal lubrication actually feels fairly similar to that. It has a similar consistency. And so women may not know if it's vaginal lubrication or if it's cervical mucus. So that's one thing that can change it. Semen being present can change it. Lubricants, antihistamines can dry up and thicken that mucus. Medications that thin the mucus, like Robitussin or guaifenesin, may make it thinner. And obviously women have to be very comfortable with their own genitals to be able to use this method. There is a 2-day method that's simplified. Each day, the patient asks 2 questions. Did I notice secretions today? And did I notice secretions yesterday? And if the answer to both of those is no, then the likelihood of pregnancy is no. If the answer is yes, they should abstain or use a barrier method. So that's a simpler way, a little bit less specific, but it is a simpler way to do the cervical mucus. There are also home predictor test kits for ovulation. They tend to be used by people trying to conceive. They're very expensive to use over and over and over and over as contraception. The Marquette model combines cervical mucus with the fertility monitor. But again, now you're using those ovulation predictors over and over and over and over. The most effective way to use these is to use more than one. So the symptothermal method combines multiple indicators of ovulation and impending ovulation. They look at the calendar, cervical mucus, basal body temp, and the position of the cervix. And the person who's using natural family planning or the symptothermal method is going to assess each one of those every single day and chart them. This can be effective for women with irregular cycles if they're very, very consistent. They're unlikely to miss an ovulation if they're using all of the signs. It can also be used to try to conceive, and it can even be used to increase the likelihood of conceiving either a male or a female fetus. That's because sperm that carry 2 X chromosomes tend to live longer. Sperm that carry a Y chromosome tend to swim faster. So intercourse before ovulation is more likely to lead to female fetus. Intercourse just at ovulation is more likely to lead to male fetus. Some risk and drawbacks. There are things that can change the consistency of the cervical mucus, and this requires so much dedication. It's got to be something they do. It's just part of their daily routine every single day, but it can be very effective. With perfect use, the symptothermal method that combines all of the things is 0.4% failure rate. That's really good. That's less than less than half of a pregnant person. So less than 1 person per year gets pregnant, with typical use about 2%, which is still pretty good. We need to talk about lactational amenorrhea, because you've probably been told that breastfeeding does not prevent pregnancy. That's mostly right because of the way breastfeeding is done in the US. If all of the rules are followed, then lactational amenorrhea is very effective as contraception, but it's difficult in our culture to follow all of the rules. Prolactin suppresses ovulation, and it will do so effectively as long as all of these conditions are met. The mother has to be breastfeeding the baby exclusively. Nothing else is going into that baby, and every feeding has to come from the breast. So no pumping and giving in a bottle, no formula, no water, no other foods, nothing but breast milk straight from the mother. Because changing that, decreasing the direct nursing, is going to decrease milk supply. And so that may cause a drop in prolactin levels and allow ovulation. The infant has to be under 6 months old, has to be feeding at least every 4 hours during the day, and waking up at least once a night to feed. And menstruation has to not have started back. Okay, so no periods. So those are very uncommon factors because of the way our culture is set up. A lot of women in the US don't have enough maternity leave to do that. They're going back to work at 6 weeks or 4 weeks or 2 weeks. And so most of the time when they say lactation doesn't prevent pregnancy, it's because very few women in our culture can meet those conditions. Ovulation is unlikely, but it's possible for that first menstruation, so there is a chance. The failure rate is about 2%, or was about 2% the last time they measured this. So that's really pretty good, but it's only if all of those conditions are met. Okay, the next section will be about barrier methods.